Hello, Sandra and hello, Sandra and Anna. The light is performing an assault on me. On me. You're there, Sandra. Did I let you in?
There we are. I couldn't get my camera on, and then I realized it was because I wasn't plugged in.
I get it. I never know what my settings are when I log in. Like, what is it today?
There we are. Yeah.
Goodness gracious. It is nice to meet you.
Nice to meet you too. Thank you for your support.
Oh, well, thank you guys so much. I can't even wait. I've never done this before. And so I called Denise. I'm trying to think what day I got a hold of her. It was Tuesday and I was super worried about it. And oh my gosh, she just put my mind at ease. You all have. I was so grateful.
Great. That's awesome. One important thing is, do you know how to assign us as interpreters when the meeting starts?
I do not. I know I assigned you in settings. I do it again once it starts.
Yes, and actually we're supposed to get like something on the screen saying you've been invited as an interpreter, and we press OK.
Okay, I have you. It says interpreter 1, Sandra, and maybe should I just press start? Do you think that would?
I would think so, yes. I've never seen it from your side, but yeah.
Let me try.
Hola, Denise.
How are you doing?
Good, and you?
Good, good. Hi, Kaylee.
Hi, how are you?
Good, good. It's nice to meet you in person.
Nice to meet you
Digitally.
too.
Thank you for sending all the documents. That was really helpful.
Oh, no problem. And I have 2 of my speakers are going to be calling in. They will not be using the internet connection, or it won't be video. Which,
okay.
And if that messes you guys up, so I'm not sure. I don't think we're going to have anyone necessarily utilizing the translation today in the meeting, but we're going to have one of my colleague is going to record it in Spanish because we have some communities that we're wanting to connect with and we would like some resources. So that is what we're going to do. Let's see. Okay, now maybe I'm going to try this now. I'm going to start the interpretation and see if did that send you guys a.
There we are.
I did. Yay. Denise, you saved me with this whole process.
Oh, yeah, no, it's
You did.
pleasure.
I was telling Sandra, I was like, I talked to Denise and I felt so much better. So thank you
Good.
so much.
That means we're doing our job well.
You definitely are.
And yeah, sorry I can't interpret, but Anna and Sandra are amazing. So
No worries.
you're in good hands.
I was going to ask you guys, so at the beginning, is it best for you guys to explain how the translation works? I have the documents that you sent me and I could share the screen and put those up. Would that be best? Oh, I think you're muted, Anna.
Huh, yeah, we can. Oh, she must be here. I can, Kaylee, if you look at the participants pane,
Yes.
you see Anna's name. You can tell it by ES. You can tell she's in the Spanish channel. And if you
Oh,
look
okay,
at
got you.
Sandra, you can tell that she's in the English. So for now, for the sake of everyone hearing each other, if you can all just go to the Spanish channel or either channel, but
Okay,
let's all go to
okay.
Spanish.
So let's see. How do I change it?
So if you go down to the bottom of your screen, you'll see a little globe that says interpretation.
Mm-hmm.
If you click on that, select the Spanish channel.
Oh, perfect. Okay.
Yeah, and you can always turn it off.
Okay. Awesome.
So
Okay,
yeah, usually when we're recording, once interpretation is activated.
Oh,
you can't hear
I
the
think
interpreter.
now, wait. Now I can't hear Denise. Okay. I'm back on English. Now I can hear you. I think.
Oh, is that on?
Perfect. Okay. Let's see. Chris, I'm trying to set you up as a host
okay.
or a co-host.
There we go.
Okay, I'm gonna allow you to record. And I think that will, did that pop up an option for you?
Yes,
Okay,
it did.
and then you'll wanna go to the little globe down at the bottom and press Spanish. So you'll be on the Spanish channel for the meeting and can
Okay.
record that part of it.
Sounds good.
Okay,
You record to the cloud.
it will record to the cloud. Is that what you said?
Yeah, don't record to the cloud because it'll record the original audio. I
Okay,
think you have to record to the computer for it to work.
okay. Did you hear that, Chris?
Yes.
Okay.
Okay. I've also put in some text in the chat if you want people to read it as they come in.
Okay,
Just remember that if they're coming in, they can't see what you put there previously. So you have to continuously putting in if there's new people coming in.
okay, I got you. So continually keep reposting it.
Yeah, like every 2 minutes, 3 minutes until everyone's come in and then you're good.
Okay, perfect.
Other than that, you should be good.
Can you hear me?
I can hear you now, yes.
Okay, okay, let me, I'm gonna ask you, you put something here on the chat. You want me to read it in English, just for people to know?
Yes, that would be great. And then also maybe in Spanish as well. That would, yeah, that would be perfect.
Okay, I'll read the whole thing you have here.
Thank you.
So for that to work, I don't know how hard it would be if you can
Go back and
take
forth?
Anna out of the if you can turn the interpretation off for Anna, because
Okay.
otherwise everyone who comes in, they won't be able to hear her.
Oh, okay. So
So turn Anna off. She'll say the script, and then once she said it, you can turn her back on.
I'm not seeing that as an option. Let's see.
I don't know if let me see if I can go back on both, if I can go on the English.
Hi, Mariah.
Hi.
Yes.
Yes, I can hear you. I'm in English. Mhm.
It's not.
It doesn't seem to be working. I think I was on the Spanish channel.
Okay.
Well, what we can do this time is, since I'm on here, I can just say this and then pop out.
Say that again.
Activated.
Denise, can you hear me? Can you hear me, Denise?
Since I'm here and you can't deactivate it, I can just read this really quick and then pop out. That way the interpreter can just start interpreting once you guys start your meeting. I can.
I'll be right back. Close.
Yeah,
Why?
what you don't have is these instructions to get interpretation. But if they don't have the instructions, they can't get into either of the language channels to hear you, so they can't hear you. So yeah, we can do that. I can stick around, read this really quick, and then be on my way. For everyone else, we all went into the language channels. You can see the interpreters, but once it starts, you can all, unless you need the interpretation, you can go into just the general non-language, no interpretation if you want, or get out of the language rooms is what I'm trying to say.
Fun is driving me crazy.
Mariah, it's good to see you.
Hi, Sister Joan. How are you?
I'm good. Thank you for saying yes to being part of this tonight.
Of course, I'm happy I can be here.
Yeah, thanks.
Usually turn it off so that they can focus on the speakers.
Turn what off?
Yes, you can both turn off the video.
Oh.
Mhm. Okay.
Chris, do you seem to be able to, do you have it set up to record? Do you think you can do it? No. Are you good to go, Chris? No, I can't hear you. Sorry, I think you're on mute.
So I'm good. I'm on the Spanish channel. I just record off this, right?
Yes,
Okay, I got all that.
thank you so much.
Hi, everybody. This is Natalie. Great to see everybody. I'm just getting myself set up here.
Hey, Natalie. Hi, Karen. I can see that you're here.
Yeah, I'm eating.
I need to eat. I'm hungry.
Well, I figured an hour and then I've got to, as soon as this is over, I've got to take my wheelchair out to feed my animals. And,
Oh, you'll be busy.
yeah, so I wanted to get some food before I did all that. That's why I don't have my picture on unless you want to watch me eat.
No worries. Hi, Teresa.
Hi, Kaylee. How are you?
Good. How are you?
Doing fine. Just got back from a walk where it was about 100-mile-an-hour wind out there. It's just awful.
Isn't it great?
Yep.
Oh.
How are you all doing?
We're doing good.
Great.
Teresa, this is Joan. Thanks for so much for joining tonight too.
Oh, our pleasure. Was there any difficulty with the PowerPoint that I sent to you?
No, I think it should work just fine. I'll just screen share as you're speaking.
That'd
And
be perfect.
yeah, so hopefully everyone can watch it.
Well, I hope it's helpful.
I think it will be great.
Hi, everyone. Just want to say really quick hi. It's Kendra.
Hey, Kendra. How
I
you
was
doing?
thinking that Kendra was on here. I was about to ask.
Good. Thanks for asking. I hope everyone's good. Everyone's staying inside from this.
Hi, Kendra. Welcome. This is Joan. Thanks for doing this tonight.
Hi, this is Carol.
Hi,
Ah,
Carol.
there you are. You're maskless. Me too. I'm maskless also. Mask free.
It's so odd to see everyone.
I was gonna say, are you Kylie Shoop?
Yes, I'm Kaylee. Yeah.
Hello?
Can you hear me?
Haley, sorry.
Yes.
You know, I used to work. I can't see you though. I used to work with a nurse. Her name was Deborah Shoop.
Oh, how funny. I don't know. I don't think we have any relation, but I could be wrong. I wonder. I'll have to ask. In
Original
Carlsbad?
Roswell woman.
I'm from Carlsbad.
Roswell.
No.
Okay.
Stop video.
Oh, okay.
Maybe there is some distant relation though.
Up there.
Possibly. I know there's one other Shoot family.
Oh, well, she was a,
Am I muted or not? Can you tell?
I can hear you.
Oh, okay.
Now Denise did say if anyone has
that's
issues,
probably the one.
if anyone has issues hearing each other, if you are switching back and forth from the Spanish to English channel, you may need to turn off the interpretation on your computer. That way you're on the correct channel. Just a heads up there. And we'll get started here in a few minutes.
I was gonna say there's a big street park in Woodland Hills, Canoga Park in Los Angeles. It's called Shoup.
Oh, really?
Yeah, Shoup Park and Shoup Avenue. It's a big street.
Oh, you know, I've been on Shoup Avenue, I think, but I haven't seen the park.
You been to Los Angeles?
Yes, I lived there.
Where?
About 2.5 years. I lived in North Hollywood.
Oh, okay. Yeah, well,
Yeah.
it's on the other end of town, but yes. Yeah.
I've definitely seen Shoup Avenue a few times.
Yeah, I grew up there.
Oh, how cool. What part?
Woodland Hills.
Okay, awesome.
And I went to high school in Studio City.
Oh, okay. So like right near where I lived.
Yeah, exactly. It's
Oh,
not there anymore. It was a private Catholic school, but that followed
Okay.
the nuns, but
That is so awesome. We're having a few more come in. I'm going to give them about 2 more minutes and then we can get started here.
My computer keeps, or my little iPad keeps winking out.
Oh no.
I hope, yeah, my husband's gonna try to set up his computer. So if I disappear,
That could be why.
there's all 3 of you. Yay!
It may just be your bandwidth. I know that we have that problem up here we're at the very end of the telephone line, so we can't do video. That's why I'm on the phone right now. And sometimes you just have to turn one or the other off.
Oh, that's it. Yeah, I'm in a neighborhood that doesn't have fiber optics. We just do the over the waves kind of thing. Maybe that's a problem, huh?
Yeah, mine has to come from it points down into downtown Roswell to a tower on top of the tallest building, and that's how I get mine. There's no wires out here.
Oh,
Okay.
well, I'm pretty much computer illiterate,
Oh, this win.
and I probably should be shameful, but I'm not. I might blink out for a minute to give my husband the meeting. Well, is my phone around here? Because it's on my phone.
Mine is on my phone right now because my computer had to do an update, like right at the last minute.
Yes, it sounds normal.
I don't know if I haven't read you, Penny, but I've read all your stories. I hope you're doing better.
I'm doing good. Yeah. Well, I just had a surgery not too long ago, so I'm recovering, but I'm doing remarkably well.
Are you living somewhere where you can breathe now?
Yes. Yes.
Thanks.
Well, if you go on mine, then I can go search for my phone.
All right, everyone. How are you?
I'm doing good. It's good to see your smiling face.
It's good to see you too. It's been a long time. I don't think I've seen you since December.
Yeah, it's been a few minutes.
Yeah, when we did our first meeting.
It's been a while. It's good to see you.
Good to see you too. I'm so glad you're feeling better.
I always hear such good things about you. Every time I hear things, I hear good things.
I hear the same about you.
So I'm so happy to see you.
I'm so happy. Okay, guys, so I think let's go ahead and get started. We might have some people coming in a little bit late. So we will have interpretation available today if you want to listen in Spanish. This goes on simultaneously, so you will switch to the Spanish channel, but I'm going to have our interpreter, Anna, explain how that works for everyone.
Thank you. Interpretation is available. Select the globe at the bottom of your screen and select your preferred language, English or Spanish. On your phone, tap your screen, select 3 dots, then select the globe and your language. If you're on a phone line, unfortunately, there is no interpretation available. Hay interpretación disponible. Seleccione el recuadro inferior en la parte inferior de la pantalla y seleccione su idioma preferido, inglés o español. En su teléfono, toque su pantalla, seleccione los 3 puntos, luego seleccione interpretación y su idioma. Si está llamando a través de una línea telefónica, no hay interpretación disponible. Gracias. You may begin.
Thank you so much, Anna. So today we have 4 amazing speakers with us. We have Teresa Seamster. I'll give you more information as I introduce them. Kendra Pinto, Mariah Gomez, and Allie Beasley. And they will be discussing their experiences doing a health impact assessment, which is something that we in the Permian are looking at possibly doing. So I'm going to go ahead and hand this over to Nick for some opening remarks.
Well, I'm certainly glad to see everybody that's taken time out today to do this. And I think it's real important. As you all know, there's a lot of oil and gas here, which makes a
92.
Oh, sorry, Nick, I'm going to interrupt you. Does everyone mind muting their speaker real quick, just so we don't have any background noise?
And as you all know, where there's a lot of money involved, there's usually not a lot of opposition. And that's been the case around here, that there's not been a lot of voices or groups organized to stand up to some of the ill effects of oil and gas. And a couple of years ago, this group was organized. There were some of us that were doing other issues with nuclear stuff and whatever. And Joan Brown and Natalie Eddie came down here and we're talking about methane and showing us through the FLIR camera the reality of what we couldn't see. And since there's not a lot of air monitoring around here, you just don't know if you can't see. And so we've been dealing with that and been doing this ever since. And the whole thing of a health impact assessment seems to be something that we should do. One of the members of this group that's not here today is Anthony Cook, who did work for the health department here and noticed a lot of things that some of the rest of us don't get to see. Anyhow, I'm glad to see you all here today, and thanks for coming and for participating and being part of it. And let's go on with it.
Alrighty, everyone. So we are going to go to our first speaker. Our first speaker today is Teresa Seamster. Teresa has her master's in education. She specializes in early childhood administration. She started working on health-related issues in the Chaco area in 2015. She's been a researcher and writer for Counselor Health Impact Reports and Assessments for the past 5 years. She is currently working with the TRIDE chapter to complete the cultural portion of the HIA and to continue air monitoring with Purple Air Network. So I will go ahead and hand it to you, Teresa.
Well, thank you, Kaylee, and thank you, Nicholas. What a nice invitation, and we are thrilled to be down here, and we hope that whatever experiences we've had will kind of dovetail and help the efforts that you're involved in now, and we know the road ahead, and we'll be with you every step of the way, and please feel free to count on us for any information we can give you. So we're going to jump right in and just talk about our health impact assessment that we did. So as Kaylee said, I'm a member of the Counselor Health Committee, and at the request of the chapter, we completed a health impact assessment in 2019 in Counselor. It's a Navajo chapter located near Chaco National Park in the San Juan Basin. And that area, like yours, has been under intense oil and gas development the past 5 years. Next slide, please. Okay, can you all see this pretty well? Okay. This map shows the master leasing plan for the greater Chaco area with a blue 10-mile buffer to protect the landscape from drilling. But if you look at the little dots, you can see yellow dots, which are new wells, and black dots, which are active wells, covering the northeast section, and they've already moved into the buffer area. Now, the Counselor area is marked with a red star, and it's deep in the development zone where now over 93% of the land has already been leased. Next slide, please. Great. Okay, this is a map of Counselor chapter, and it shows a half-mile boundary around the horizontal wells, the vertical wells, and the new wells. So in purple, brown, and light blue, the new wells are the light blue ones. The small dots represent inhabited structures, and it shows that the majority of our residents live 1/2 to 1 mile from an active well, except for down in the southeast corner, which on my screen is cut off. Let me move that. Okay. And that area has been leased, but so far it has not been developed. Next slide, please. Okay, this is Kendra, and she'll be speaking next. She's installing one of the spec air monitors that we use to measure PM 2.5 levels in Counselor. The protocol that we used was developed by the Southwest Pennsylvania Environmental Health Project. Okay, and which is a national program that works with communities that want to know what chemicals, okay, what chemicals are being emitted from the nearby oil wells, and what are the health risks from exposure to those chemicals.
Thank you.
Okay. And just so you know, the pollutants that we monitored were particulate matter 2.5, formaldehyde, hydrogen sulfide, and volatile organic compounds called VOCs. Okay, so these, hang on a sec here. Okay, this is a map that shows the 8 monitoring sites that we set up in Counselor and the air pollution levels at each site. Continuous levels of PM 2.5 were analyzed from each monitor, and then they were paired with a weather impact program to develop individual plot maps. In the upper left-hand corner of the map, you'll see 2 sites that look mainly green and blue, and those are healthy readings. And if you look to the south and east, you'll see yellow and red unhealthy to hazardous readings. Okay, next slide, please. So this is a plot map for the site that had the highest PM 2.5 levels over a 1-month period. The residence is in the center of the crosshairs. So you'll see it with the little number 67. And this plot shows unhealthy to hazardous levels present during moderate to high wind events, or from 15 to 50 miles per hour. At these wind speeds, the well emissions can blow over to a site before they have time to rise up and mix with the open air. So wind speed and wind direction are really important when you're measuring the air pollution in your area. One other reason you'll see, kind of unhealthy air coming from 2 different directions. This location was within 1/2 mile of more than one well. So it was getting multiple sources of emission. Next slide, please. Okay, so our team included 2 consultants, Dr. Lewis and Sujit Jaganpalli, who's a medical doctor. They're both with the Environmental Project, the Environmental Health Project in Southwest Pennsylvania. They analyzed our monthly PM 2.5 data and determined several reasons why counselors' levels were considerably higher than levels they had monitored in other oil and gas communities in New York, Ohio, California, and Pennsylvania. Primarily, the reasons were the close proximity of homes to wells and pipelines, the high density of wells and pipelines, the location of homes that had no trees around them or other buffers like hills or mesas, and the high number of windy days. The only effective remedy for these conditions is to trap the emissions at the well site. Next slide, please. We also tested for volatile organic compounds. The Summa canister that you see there on the box is what we use to collect 24-hour air samples. Lab analysis for 75 different VOCs detected 7 toxic chemicals that are listed there. All of those chemicals are highly toxic, and some have, in fact, one of them has actually been banned. The trichloroethene has been banned for use in any agricultural application. So we were surprised that that even showed up. None of our 1-day samples exceeded the permissible exposure levels, or PEL. However, the levels are used to determine an 8-hour exposure level for workers, not for residents who live near the wells, who may stay at home all day and be exposed for 24 hours, such as elderly adults and preschool-aged children. Okay, next slide, please. We also tested for hydrogen sulfide and formaldehyde. Sulfide was not detected on that 1-day sample, but Kendra actually found high levels of hydrogen sulfide close to the Liebrook Elementary School, or community school, pardon me. It actually goes up to grade 8. And those levels were exceeded the ambient air standard on the day that we tested, however. And the way we tested are those little badges that you see hanging on the wire fence there. There's an arrow pointing to a little square badge. That is a formaldehyde badge. So at at all 4 levels, we found formaldehyde at unhealthy levels at 0.007 up to 0.0097 parts per million. Now, the permissible level is 0.003 parts per million, so that's well over PEL. When formaldehyde is inhaled, it can cause coughing, sore throat, nosebleeds, and eye irritation, and it can lead to cancer of the nose and throat. Formaldehyde is a preservative that's used in well operations, and if you detect its presence in an open air sample like this one, it's an indicator that other chemicals of concern are likely to be present as well. It's just, there are over 600 chemicals out there used in fracking, so this is what's called an indicator chemical. Okay, next slide, please. Okay, following the month of air monitoring, health surveys were conducted by CITI trained volunteers at people's homes and at chapter meetings. There were 80 respondents out of counselors' population of 700, which is a little over 11% that responded. 84% lived within 5 miles of a well. This list here is the top 20 symptoms reported by residents living near oil wells nationally. And it was, again, developed by the Environmental Health Project for communities to use in evaluating symptoms that their residents were reporting. The most reported symptom was sinus pain and discharge, followed by sore throat, coughing, headache, shortness of breath, nosebleeds, and eye irritation. These symptoms are consistent with repeated exposure to PM 2.5 and the elevated levels of formaldehyde. Okay, next one. So these were our conclusions. The health risks from elevated PM 2.5 and the formaldehyde emissions is significant and needs to be mitigated. Chemical toxicity, we found out, in humans can occur within minutes of an unhealthy hazardous exposure. It does not take an hour or 2 hours. It can be a blood gas exchange in a matter of minutes, depending on the degree of the hazardous spike that the person is exposed to. Repeated peak exposures can cause acute symptoms, including fainting, collapse, and loss of ability to breathe. And it can also lead to chronic illness, including cancer. And the little chart off to the right shows McKinley County and Sandoval County in red, and then Rio Riba and San Juan up in the northwest corner. These are 4 counties very close to Counselor, because Counselor is right on the border, essentially, of 3 of those counties. So those are the counties in New Mexico that do have the highest annual incident rates of cancer. The state air monitors are located too far away, and I think the closest is 65 miles, and are not able to assess local health risks. So it was important that we did our own air monitoring locally. Okay, next one. And this is our last slide. When we put this slideshow together, it was in May, and this was a wellness walk that took place. A lot of our Counselor Health Committee members participated in that walk. And as they were walking along the road, they were continually being passed by the trucks and the tankers from the oil fields. So that's just kind of a representative image of how the people are constantly surrounded by this type of development. So our HIA findings were approved in March of 2019 by the Navajo Nation Human Research Review Board. And later that year, the State Land Commissioner, Stephanie Garcia Richards, issued an executive order acknowledging the cultural, environmental, and health impacts on Chaco community residents, and she halted all new leases on state land located within the 10-mile buffer surrounding Chaco National Park, and she also came to Counselor to sign it. Governor Lujan Grisham has formed a methane advisory committee that Mario Atencio, who's one of our committee members, is a panel member of. And they are developing regulations to capture well emissions. The New Mexico Environment Department has held public meetings on produced water, and the Department of Interior announced a 1-year moratorium on all leasing in the Chaco buffer zone. Recently, President Biden has ordered a pause on all leasing on public lands while the impacts of oil development are calculated. So there is some steady progress. These are the people in the committee, and we have many people that we have a special thank you for helping us with doing some of the research, looking up some of the statistics, and also helping with the funding. So thank you. And I thought maybe we do have a few minutes. If we presented some of the concerns that seem to touch on what you're interested in, that's good for us to know, and that way we can supply you with a lot more additional information. This is just the tip of the iceberg. But if anyone has questions, please let me know. Thank you.
To put them in the chat if you want to. And we will also do a Q&A portion at the end as well. Thank you so much for sharing with us, Teresa, the amazing work that you guys have done. Our next speaker is Kendra Pinto. You saw her in the slideshow. She has her BA in Environmental Studies from Fort Lewis College. Kendra first became involved and active in the Greater Chaco region in 2014, collecting public health data, collecting public health and safety concerns and delivering an urgent message, to New Mexico congressional members to consider the need to take a closer look at oil and gas drilling, especially proposed industrial infrastructure near residential areas. So take it away, Kendra.
All right, thank you, Kaylee. Hello, everyone. Namaste. My name is Kendra Pinto, and I live in the Eastern Agency of the Navajo Nation. Counselor Chapter House is my home chapter. I reside on tribal trust lands, otherwise known as a home site. I'm in an area known as the checkerboard. So this means there's an assortment of land management by federal, state, tribal, allotment, and private landowners. Because this creates a spider web of miscommunication that can happen relating to how the land within this area should be used. Some say let's develop and survive today, while others say let's stop and recognize potential negative impacts to food and water. But we need to remember that every decision we make now will be affecting our future generations and their quality of life. The proposal of the health impact assessment was a huge step in highlighting the issues the tri-chapter faced. It started with meeting after meeting, and those meetings we discussed what can we research, or what can we record, who should we contact, where should the study be done, how soon can the project get started. Because the committee was formed by sort of a larger group sprawled across a large area, the meetings were held in several locations, I think outside the tri-chapter area. I think this is just to make sure that everyone who was involved stayed involved. Constant communication was key. It was absolute key. We had to make sure that everyone was communicating and staying on the same page for the HIA. That itself was a huge, huge effort. Folks had other jobs they were doing. And so it was really great to form this really solid team. And the commitment was really great. And we needed that commitment from folks. We worked with a team that understood the need to look at the impacts from fracking from a health perspective. I noticed the air changing within my area around the same time I started getting involved. So about 2013, 2014 is when I noticed everything was changing. It used to be we could occasionally smell gas odors from new fracking sites. It was pretty common, which is, it shouldn't be, but because they're not really maintenance regularly, it happened. But with continued conversations about the impacts of fracking over the past few years, it definitely has led to some changes. In the beginning of my involvement with this, there was very little data on the counselor area and all the activity was happening around it. Even with provided literature of public health dangers and fracking, it was a really hard issue to discuss in this area. I'd like to thank Samuel Sage, the community service coordinator at Counselor Chapter House, for connecting me with the individuals who participated with the HIA. he was the one who put me, in contact with individuals who would stop by the chapter house to let him know that, hey, I think something's going on near my house, or I think something's wrong. He was a super important key in all of my work that I did. He's pretty well known in the counselor area, and so that led to folks trusting him to share like how they felt about the activity around them. The process, the HIA, it seems simple enough. Go out, find folks to talk with. Would they be willing to share publicly how the industry is affecting them? Write it down and then report back to the committee. But the hardest part of that process was finding willing folks to go on record. I mean, I can understand why. I see how one would be opposed to publicly saying fracking can be harmful because it can create like an environmental label. And so, that has its good and bad views by the general public. What were some ways to get over this barrier was a constant question of mine. And soon the proposal of, anonymous next to a statement as instead of, the first and last name was brought up. It wasn't ideal, but it was a good way to open a few more doors. A few of the people I talked with had in one way or another been involved with the oil and gas industry. In an area that's littered with natural gas sites, it was surprised that the study was questioned by the community. Questions like, why look at the harms now? Is there really a need to be concerned about these sites? And if the issue is brought up, will others listen? Those are pretty common questions I got as I talked to folks. During the process, the chosen sites to host the air monitors had to be done well in advance. Who would be willing to host an indoor and outdoor air monitor, and where would they be placed with the community? Eventually, 8 locations were chosen. Mario, Teresa, Sam, and I went out at different times to place the monitors. Placing the indoor monitors is pretty simple. Find a level surface near an electrical outlet, preferably away from heavy traffic like the front door or the back door. The outdoor monitors had to have a form of protection from the elements like rain and wind. So we kind of came up, we sort of engineered a DIY box for these monitors that really worked. We placed them on these fence posts, and it worked really, really well. I had to go out now and then to check the monitors to make sure they were up and running and they were still recording data, because it's really windy out here, just like it is today. So we need to make sure that none of it disappeared. And we also had to ask the homeowners, basic questions such as, is there a indoor fireplace or not? The readings could differ slightly, if the smoke from the wood stove sort of came out and the indoor air monitor picked it up. Wood stoves are pretty common in this area for heating and cooking purposes, so we just wanted to make sure we took care of that. On the days we set up the monitors, it was sunny, and I don't really remember the winds, but I'm pretty sure they were very low, pretty ideal conditions, kind of calm. We explained to the host that the monitors were recorded over 30 or so days, and that it would be part of the final report of the health impact assessment. I did testing of the air in 2017 using the bucket brigade method. I collected the samples in the early morning so I can get the best readings of the day. Each site was chosen based on its proximity to oil and gas well sites. Out of the sample sent in, one of them showed elevated levels of hydrogen sulfide. Teresa mentioned that not too long ago that it was taken near Liebrook Elementary School. The findings were becoming clear. The air was definitely being subjected to fluorine compounds. Reporting the test results to state legislators was imperative. Along with members of the Greater Chaco Coalition, we shared it with legislative staff, and we urged the congressional members to take a serious look at the impacts of fracking and how it can affect local communities who are directly placed in harm's way. The data that's been collected over the past few years is a huge step in addressing disparities imposed upon people for the sake of economics. Fortunately, the air tested directly near my house is pretty clean and free of VOCs, but I think that has a lot to do with the terrain I'm up in a mesa area, and so the winds come from the south. And Teresa mentioned it. You know, it depends a lot on the terrain surrounding you. You know, the trees and the barriers. So we're in a pretty good spot in Lybrook, but activity has increased in the area. So I mean, the air is probably very different right now compared to 4 years ago. Our area is relatively cleaner than the Day Mesa area of Counselor, which is south of Counselor that Teresa mentioned earlier. You know, with the proposed fracking leases that are coming up, there's really no guarantee that our area will remain clean enough to hold its grand title of fresh.
Did anyone else lose her? Can you hear her?
Well should happen, but realistically, I mean, how many of those wells are actually checked annually? I remember hearing a comment from BLM a few years ago, and they noted that they visited 100 sites and only one of them had leaking emissions. You know, I was pretty curious to know what area they tested. It would seem that the sites located away from city and state official eyes are more likely to have faulty equipment, you know, that leads to potential continuous leaking emissions. I've personally gone out into the field with Natalie Edie of Earthworks with the flare cam, and we spot leaking or venting emissions pretty regularly, which is pretty sad. And it can be a common theme in a day's work. Recent trips out to the area, there was quite a few enduring resources sites that performed pretty badly through the flare lens. And so what we're going to want to do is file complaints with the New Mexico Environmental Department. And before I've done that, I filed a complaint on the website. It wasn't answered by NMED. It was answered by the New Mexico Oil Conservation Division. So it's kind of tricky how they handle these instances over in Santa Fe. I mean, it's imperative that we keep records like this of any type of violation, especially from community members who see it firsthand. The HIA was a great vessel of information on oil activity affecting people's everyday routines. We have it all down and written, and it's sort of like a small package. We can deliver directly to local community members, as well as legislators who are chosen to represent the community, and they have to make these decisions that affect numerous livelihoods. There's an enormous amount of space to hike over here in the Lybrook Badlands. It's something that I used to do on a daily basis. That's really how I became involved in this work in fracking, because it started becoming more evident in my day-to-day life. You know, it was popping up everywhere I roamed. So this eventually led to the question, is this activity harmful? Every community experiencing this type of oil and gas industrial activity should be a part of the conversation from the beginning. We're the only ones here dealing with it on a day-to-day basis. I think the conversation around fracking has changed in the tri-chapter area, but that change can be so incremental sometimes that it's hard to imagine data collection as a game changer. It's definitely worth the time and energy that goes into the HIA process, and I'm very happy that everyone here is wanting to be involved on the ground level. It's super important and it's needed, and I'm here to help in any way I can. And I wish everyone luck with this. You know, it's a really long and it can be a pretty hard process and frustrating. So, you know, I'm sending good vibes to everyone down there that wants to look into these issues. And that's all I have for now. Thank you, everyone.
Thank you so much, Kendra, and for those good vibes and sharing your experience, you know, where you are, which sounds like it could be a similar environment, you know, trying to get people to talk about what they're experiencing. It's easier said than done. So thank you so much for sharing with us. Our next speaker is Mariah Gomez. Dr. Mariah Gomez is from El Rancho in the Pojoaque Valley in northern New Mexico. She earned her PhD. Sorry. I apologize. I lost my.
Did I mess you up? Sorry.
No, it's okay. You're totally fine.
Trying to jump the gun here.
You're totally fine. She earned her PhD in English with an emphasis in Latina literature from the University of Texas at San Antonio. In 2017, she helped the Tula Rosa Basin Downwinders Consortium research and write the health impact assessment titled Unknowing, Unwilling, and Uncompensated, the effects of the Trinity test on New Mexicans and the potential benefits of the Radiation Exposure Compensation Act amendments. Mariah's current book project, Nuclear Nuevo Mexico, Identity, Ethnicity, and Resistance in Atomic Third Spaces, examines the effects of the nuclear industrial complex on Nuevo Mexicanos. And go ahead and take it away.
Thanks, Kaylee. I'm going to go ahead and share my screen. Let's see if I can do that. Okay. So thanks for inviting me tonight. Y también gracias a las traductoras para su asistencia esta noche. I was lucky enough to work with the Tularosa Basin Downwinders Consortium on their HIA, which we completed in February of 2017. And so I'm going to talk a little bit about the process in reflecting on some of the questions that Kaylee had sent me and how just ideas that might help you all get started with your HIA or facilitate a good HIA. So kind of some takeaways from my experience. So in terms of what I did with our HIA, I was in charge of organizing the research process, and I'm going to talk about all of these elements separately later. I worked on gathering data, analyzing data. I wrote the report. I shared the report, and I posted it on the website. So that doesn't mean I single-handedly did some of those things. Those were just all of the elements that I was involved in. So for example, a little bit later, I'll talk about the fundraising aspect. Like I wasn't involved in the fundraising aspect, for example. So just a little bit on the process of writing an HIA. And again, I'm not talking about like the fundraising at this moment, but I will talk about that because it's important. I think that there are some key steps to completing a health impact assessment. So for example, I would start with thinking about the proposed policy or plan that your HIA would affect. You want the community to guide this. And one of the best ways to do this is to hold a listening session. So if you all were to, I mean, in your process, you'll probably do various focus groups, but this would be like an initial listening session, and you might hold several. You know, you all are, of course, very aware of holding bilingual events, but you may organize one specifically in Spanish and target specific communities, because I think that one of the, just from my research, and I'm telling you things that you know, but from my research, you know, not making events that are accessible for Spanish speaking communities, but creating events specifically for Spanish speaking communities is going to bring you a specific audience, I guess, in the sense that you might hear of different policies or plans that your HIA might impact. So that's just advice on that aspect. The next step that you would probably want to take is looking at your health determinants. So these might be social, economic, or environmental health determinants. There's a lot of literature out there about about identifying health determinants or social determinants of health. So that would be the next step. And then once you've identified a plan or a policy that your HIA is going to impact, and you've kind of determined your factors that you're going to focus on, which I would recommend 3 to 5, you want to start to basically do a literature review. What type of research exists on this? You might look for similar HIAs that have been done, maybe not in New Mexico, maybe in Southern Colorado, maybe in Pennsylvania, maybe in other parts of the country where oil and gas are big industries that are affecting small communities or rural communities. You always want to keep in mind, like at every step of the process, how you're centering community stakeholders. You know, are you coming back and checking in with community? Are you keeping them up to date? So like one of the things that we would try to do was update our community vis-a-vis our newsletter that would go out. So just ways to center community, not just by informing them, but also by including them in different parts of the process that you can. The next question is, and these may not be in like exact order, because I think budget's something that you might want to consider even before you get started. I don't know what y'all's situation is in terms with your budget right now, but I would definitely recommend applying for various grants. There are lots of grants out there that support, nationally at least, that support HIAs. So, you know, you may actually just have one person who's tasked with being the grant writer for your group. And in fact, I would recommend that, like 1 to 2 people, because grant writing is a beast in and of itself, which you all probably know. And then you want to gather and analyze and organize your data. So I've clumped these all together, but this is the majority of your work, right? You will be, it would be smart to split this up. You know, you may have one person in charge of doing a lit review, one person in charge of hosting focus groups. And then even at the focus groups, you might break that down further. So one person is going to take notes on a computer, one person is going to write notes for the meeting, you know, different roles and jobs. And then organizing your data, or analyzing the data and then organizing it for your report. So by organize, I mean 2 things. I mean writing the actual report, which is part of the analysis, but then also preparing it for public presentation. So in the next slide, I think I talk a little bit about actually hiring somebody like a professional designer to put your HIA together. That was probably the best step that we took. It wasn't that I couldn't do it. It's just that I was so like drained from writing the report that our editor was able to edit the document, do copy editing, and then also put it together just in a fabulous format. And I'll show you our HIA when I'm done. You also want to have a media advocacy plan. So how are you going to share your report? Are you going to have, so for instance, we had 3 events for ours. We had a release event in Tularosa, a release event in Albuquerque, and a release event in Socorro, I think. And in addition to those events, we had press releases that went out to the news stations, to AP, et cetera, et cetera. So basically you're coming up with a full media advocacy plan. And then finally, when all is said and done, I think it's really important that you come back and reflect with your team. So what you'll find is that not everything is always perfect. You'll find ways that you could have done things better. You'll find places in your HIA that could have been improved. And it's a learning process, right? Like you're never going to get this perfect 100% of the time. That's part of what makes it an HIA, a health impact assessment, is you're trying to gauge what's going to happen. It's not, you know, this is kind of like a hypothesis in and of itself. If anybody has questions, you can always interrupt me while I'm talking to you. I pulled this graphic from the New Mexico Health Equity Partnership, which I'll come back to, and I have the link in the next slide. This is kind of a really cool graphic for the HIA process. So they've identified in this 6 steps: the screening process, the scoping process, the assessment process, recommendations, which is the actual coming up with the recommendations before the reporting, and then the monitoring and evaluation. So this is essentially what I've kind of outlined in the previous slide. It's just in a really, really cool graphic that if you are much more of a visual person, you can appreciate. So in terms of my biggest takeaways from this process, I think I have more than this, but these were kind of the main ones. You know, coming up with clear social determinants of health was key. This took us a very long time to come up with. And it's not because we didn't know how the policy or the proposed policy was going to affect our communities, because we did, but we needed to be able to write about how or analyze how. So like I said earlier, I think that it would be a good idea to look into the existing literature on health determinants and, you know, see how those are crafted and created, because I think depending on the perspective that you're coming in with and the group you're trying to target and the type of legislation or policy that you're trying to impact, it really varies. The community felt like they had needed this document for a long time. I don't think I really understood the type of impact that this document was going to have. So like even the fact that Sister Joan was so gracious and Joni too, I think were so gracious on like saying, hey, invite Mariah to talk about this. They know, or they saw firsthand like how much the community needed this. People were literally taking the document and grasping it like this to their chests because they felt like they now had something that was justifying their experience in their community. And that was the most powerful thing about it. The second thing, and I guess it's really the effect of that, is that the process was exhausting. So not only the process of the HIA process itself, but like the very last step, which was not the very last step, but the sharing of the document. We held 3 events, like I said, within 5 days. And it was just so absolutely exhausting because of the mental exhaustion, or rather the emotional exhaustion that came with that. Like not even the physical and the traveling, like that was hard enough. But because we are writing, and you all too are writing about issues that are affecting people's health, people's safety, people's environment, you know, people are just coming with so much trauma and they need an outlet for that trauma. And so eventually that just pours out. People want their story captured. You know, if I could have gone back and written a second HIA based on the new people that we had encountered and the new stories that we heard just in those 3 events, like we could have fielded a HIA like twice as good as this. And that's that we were working with like 800, I think we had about 800 surveys to begin with as part of our data collection. I believe we were working with about 800 at the time. Now I think Tina has like twice that much at least. So it ended up, the HIA made the issue more visible. People were able to, you know, learn about this survey that existed, and it was just a better way to gather and localize information. The other thing to be prepared for is government agencies' response, right? So the community is like the good side, whether it's exhausting or not, but then governmental agencies. So we were totally discounted. Our report continues to be called anecdotal, which is, you know, a reductive way to think about the type of data, the type of qualitative data that we were gathering, and the type of research project that we had undertaken. And I think that, you know, take this how you wish. Like one of the responses that I always give people, and this is one of the things I teach when in my classes, is, you know, we're coming from oral traditions and cultures of oral traditions and oral histories, right? These are the ways that our communities have existed in New Mexico for millennia, right? Our indigenous communities are and continue to be oral communities, oral traditions that carry on histories through orality, as do our Mexicano and Nuevo Mexicano communities. So, you know, now when we get called anecdotal, or our report gets called anecdotal, I try to look at it from a positive standpoint and saying, yeah, because my people are people who come from an oral tradition. A few things about what I would do differently, or just general advice. I would have held more focus groups. I think that we stuck so much to the surveys that when I saw how many people came out in full force for the release events, I just wish we had organized more focus groups, and really we just didn't have time. Part of that is because I would have delegated some of the work. So I wish we would have had like one person responsible for organizing focus groups, or one person responsible for whatever. You know, we delegated work pretty well among our team. We did have weekly calls. We met once a week for like, I don't even know how long, which was exhausting, but it kept us all on track, and it kept that line of communication open. I would also think about paying everybody who works on your HIA if you hadn't already considered that. I think that it's just a value statement. And along with that is applying for grants. Apply early, apply often, apply throughout, because you might have the opportunity to write a second HIA. And, you know, the best time to do that is when you have all the momentum after the first one. I would also take lots of photos. This is something we did do. We had lots of photos and lots of videos throughout our process, the whole process. So if we had the candlelight vigil that year, we took photos. We were able to use these for media, but also for applying for subsequent grants, and also for our website. I mentioned this already, but I would hire somebody to format your HIA and make it look professional and also do your copy editing. Teresa earlier mentioned that they had city certified researchers. So I am city certified and I felt comfortable doing the data collection. I don't know if your team necessarily has to be. I know that they also had to be approved by the Navajo Nation IRB board, the Institutional Review Board. But if you don't have to do that, you may not have to go through it, but you may look into this anyway. So the website is cityprogram.org to look into the city training. And then I mentioned the New Mexico Health Equity Partnership. I showed the graphic in the last slide, but they have a ton of useful information. So I would take a look at their page. Kaylee, I'm going to send you my PowerPoint after, so you'll have these for your team. And you know, I just want to shout out Jessie Espinosa Jensen, because without her, we wouldn't have been able to complete our HIA. Like, she kept us on track. She's just a phenomenal human being. And like, I call her my friend now. She's just a wonderful, wonderful person and so kind and gracious. And, you know, I don't think I actually understood what an HIA was until we were done with it. Like, because it just seemed so elusive. Like, you all are on the right track by trying to understand it first. So one good thing about the NMHEP page about the HIA is that there are examples, and I found the examples to be very useful in our process. And then how was community engagement during the process, and what was the reaction to the info that the HIA uncovered? So like I said, the community was engaged throughout the entire process. We included them in community events, interviews, small focus groups, the surveys, and then in the HIA release events. The HIA release events were just entirely overwhelming. The trauma that people carried came pouring out during the release events. And then the government reacted strongly. Last summer, they released reports from the National Institutes of Health and the National Cancer Institutes that basically negated our report. They were almost written like in direct response to our report. That's a whole nother story that I could talk about like a different time. But again, they continue to call our report anecdotal. So just be prepared for that, I think, because, you know, while we might not consider them community or parts of our community, at the end of the day, who's controlling those policies and procedures that we're trying to change, right? And lastly is just my contact information. So I'm happy to answer any questions or give you all any further advice. So you can reach me at mariag@unm.edu. And I also just want to show you really quickly what our HIA looked like. Let's see if I can do that. Oh, the Zoom life going from screen to screen to screen. Okay, so this was our report. The final page count was 86 pages, but you can just tell how, you know, these are photos we collected throughout that we were able to use. It just looks really clean. And this is available on the Downwinders website if you want to take a look at it. It's also on the NMHEP website. We also I made sure that we had hyperlinked everything. Since your document's going to be living online, you want to check your hyperlinks and make sure they work as well. And then we also put our survey in the HIA so that people were able to easily access it, complete it, and turn it back in so we could continue collecting data. The other one I wanted to show you is one secondary document that we created, which was the fact sheet, which accompanied our HIA. So this was something that we were able to quickly use at events. It's a 2-page, and of course my phone would ring, sorry about that. It's a 2-page fact sheet that just basically summarizes our HIA. So we have our recommendations. That's like, at the end of the day, that's the most important part of your HIA. So we have our recommendations there, and then some of our excerpts from our testimonies that we worked on, and then contact information. So at the end of the day, you know, the question is, was our HIA effective? I think it is. Tina just testified last week, 2 weeks ago, to the Senate Judiciary Committee again. We're still trying to get the Radiation Exposure Compensation Act amended. And we'll continue. I mean, lots of people are working on this. So that's all I have. That was a lot, sorry.
Do not be sorry. That was great information. Thank you so much. And I really stuck with me how you said they felt justified in their experience from this. I thought that was really powerful. Last but not least, Our last speaker is Allie Beasley. She has her JD and MPH. She is an attorney at Western Environmental Law Center. She grew up in Oklahoma with oil and gas literally right in her backyard. So you can go ahead and take it away, Allie.
Hi, everyone. Thanks so much for being here and having me. And I think everyone else has just covered a lot of really great and important points, and I'll keep this fairly quick and let us move to questions and answers. But wanted to talk a little bit about some applications that we're seeing of HIAs, like in my work and here in New Mexico potentially, and a little bit about how I've seen them applied in some of my prior work. So in terms of the counselor HIA, the sort of part one air monitoring data in particular that Teresa and Kendra were talking about, that has been given to Western Environmental Law Center, and we have cited to it in comments and protests of oil and gas leasing and resource management planning and permitting. And I just agree with what Mariah and Penny said about the sort of reductive approach that federal agencies like BLM and BIA and Interior Department and EPA and all of them have to these things. And we have also seen some pushback, but we've also seen a little bit just recently-ish, we're starting to see maybe them take it a little bit more seriously. And I'm hoping that maybe I don't really still, trust them under the new administration, but there are, even with some opening up of various agencies processes asking like, how can we better look at cumulative impacts and health impacts and environmental justice and things like that. Maybe we will see them take things like this a little more seriously. And what we have been seeing even a little bit is things like, health disparities or social determinants of health language at least showing up in some of their environmental assessments or impact statements. That doesn't mean that they actually really take the serious look at them that they need to, but we're starting to see, I think, a little bit of influence there. And then from there, when challenging, say, a permit or an oil and gas lease sale or things like that, we are actually starting to even see in our cases, and then there are some other cases from other areas where we're seeing this as well, judges start to actually, invalidate permits or leases or things like that, citing to, in particular, sort of health data showing adverse and disproportionate impacts in a particular area. And I think one thing that's really important to note with these HIAs and with the counselor HIA is that that sort of local level data is actually starting to be helpful and persuasive in pushing back on agencies who are typically, they have been able to just say, oh, well, for air pollution, for example, we aren't violating the National Ambient Air Quality Standards for ozone or PM 2.5 or whatever are not being violated. So there's no health problem or there's no environmental justice problem. Everything's fine. And we did our analysis, and actually being able to have some of this local level data is actually starting to be helpful in pushing back on that in some cases, where you can actually point, and judges have started to point this out and say, actually acknowledge, that the NACs cover these broader sort of county level areas, and ostensibly are supposed to be protective of public health, and that's a whole other topic that I don't necessarily think they do to begin with, but especially at these levels. And so having HIA data with local air monitoring, for example, or local water quality monitoring showing local health impacts, we are starting to see that help push back on that sort of, well, the NACs aren't being violated, so everything's fine. We are starting to see slowly but surely that actually start to be more powerful in pushing back on that sort of thing. So I did want to sort of share the potential of that. And yeah, I think in general as well, just there are sort of lots of other folks have, I think, spoken to this really well in terms of all of the ways that this information can be really powerful for you all in the community with legislators, maybe even potentially agencies, judges, that sort of thing. One other example, not with oil and gas, but in my previous work where I saw it be really helpful at the county level was it was technically a community health assessment, not a formal HIA, but this sort of community health assessment data was used to look at inequities in access to fresh food and grocery stores and things like that in a rural county in Northern California, and actually changed sort of county policy around food access. And so, I have seen them make a difference, and even with some federal agency decision makers and judges and things like that, just in the last year, we're really seeing this information start to have a more powerful impact in that arena as well, I think. So, yeah.
Thank you so much for sharing with us today. And that's really inspiring that it really is moving the needle. And for me, the reason I'm involved with all of this is because I could see health impacts in my community and I really didn't know where to turn. And so the work you guys are doing is so incredible and so inspiring. And just thank you so much for sharing with us. I want to turn it over. Does anyone have any questions? Anything like that? If you just want to unmute yourself and go ahead and ask.
Kaylee?
Yes.
I actually have a few questions for the group here.
Yes.
I've been looking up some of the statistics recently about the Permian, and it seems to me there are at least 3 areas that you might want to collect data on, whether or not it ever turns into an HIA. You might want to collect data on things like injection wells and earthquakes in the area, because I've noticed that there's an increase in incidence of that. I think getting air quality data would be important because the asthma rate in the Permian is very high, one of the highest in New Mexico. And I think also just overall air quality, the Permian is registering some of the worst air quality in the country. And I think Natalie might have some, really important collected data. The Earthworks team has just done some amazing data collection that you could refer to, and then you could go out into areas that you feel are hotspots in your communities and take some measurements and see if they correlate well. Part of the pushback that Ali was mentioning, I think we're going to see with our purple air monitoring, we've been doing some quality assurance with those monitors to see if they correlate well with kind of an EPA or a federal equivalent monitor. And one of the first things you would want to do if you get, say, a couple of purple air monitors is to co-locate them. So you can have one checking on the other to make sure that, at least in terms of the the specifications of that monitor, that they're performing correctly. And that also kind of adds to your quality assurance when then you're reporting back to the community. You can say, yeah, this is monitoring properly. And I think the, kind of overall, I guess my question to the community would be, where do you see your biggest problem? What bothers you the most? Because I know with Penny, I mean, her experience is so well known now, with the produced water. We had something like that went over on property that belongs to Mario Atencio's family. Just thousands and thousands of gallons of produced water and crude oil, and all of those chemicals mixed in, and it still has not been removed. So it's really, the community that will tell what needs to be done. It's what bothers you all the most that you want to pursue. But we would just be very happy to share, any bit of knowledge that we have on any specific point that you want to send our way. So, Those were my questions.
Thank you so much for that, because yeah, like Natalie just put in the chat, that's an exceptional resource for us. Does anyone that is in the community want to take that question? Is there anything that specifically you are very concerned about? I also, produced water really worries me. Along with Penny's story, produced water is something that does make me very nervous, and I would like to look into that. Anyone else though, other than air quality, any other?
I don't think it's just produced water though, because I lived there before the accident, and I was dealing with flares and the noise and trying to breathe throughout all that time. I had 2 flares 300 feet from my front door, right in front of my front door. I mean, I have pictures of them. Natalie's seen them, everybody's seen them, Joan's seen them, right there. I mean, we'd come out our front door and the first thing you'd see is these 2 flares outside my front doorstep. And trying to breathe that every day was, it's toxic. I mean, it was hard to breathe, and we were constantly dealing with headaches and nosebleeds, and you know, and this went on for years before the accident. So it wasn't just the accident. That was the icing on the cake. I mean, that was just the worst, you know, but it was years of torture. It wasn't just the accident. So, I mean, it's,
Yeah, and
there's a lot. I mean, there's a lot.
As someone who lives not in the heart of it like Penny did and you guys down in Artesia, but I before I broke my leg, I rode a motorcycle all over the state. Right. I traveled. I'd cover sporting events in Hobbs and Carlsbad and Artesia, and every time as I started getting into Carlsbad, the air, just smelling it. And I mean, I can imagine, I mean, the tourists, I can't imagine how the tourists, what they think, you know, when they come, they're coming to see Carlsbad Caverns, or they're coming to, you know, something like that. It's just horrendous.
Indeed, indeed. And this used to be a touristy place, and it's now, I mean, the river has gotten, nobody wants to swim in it anymore. And it used to be a place people wanted to go. Yeah. It used to be, I mean, all the stonework they have on that river, it was at one time a resort kind of place. And now nobody wants to go to it. They had
they used to have motorcycle rallies down in Maryland.
They put up a water park because nobody wants to swim in the river anymore.
Yeah.
Why? What happened to the river that nobody wants to swim in it?
Yeah, we are definitely not treating our environment like we should be.
Exactly.
By any means, and it's hurting our community.
Exactly. And people, my husband lived there since he grew up there. That was his home. And he talks about swimming in these, and he took me to all these places, you know, and you know. But now you can't even get there because they've fenced them all off because of oil field traffic, and it's not safe to go out there anymore. And I mean, they've destroyed this beautiful community.
And that's not even mentioning overpopulation and all of that.
Yeah, and it's just, they've destroyed our communities. And this is what is happening to our community. And this is why we have to
fight back.
Yeah.
Our band together, you know.
It's not our land, our water, our air is all being raped, you know, by oil and gas.
Mhm. Yep.
And we're in the midst of it, trying to breathe, trying to drink water that is not good anymore, because every year the water gets harder and harder and harder because there's less and less water, because they're sucking up the water more and more and more, so it gets less and less water, so it gets harder and harder and harder.
Mhm.
And the water we do have, you know, they're poisoning with toxins, you know, and the air is getting full of PM 2.5. I mean, it's
VOCs everywhere. Yeah.
VOCs.
Mhm.
We're trying to breathe this,
Yep.
you know, and then the truck traffic, and they're putting all this stuff from the trucks up into the air that they've spilled onto the ground.
Yeah.
And now they're running over and it's putting up into the air. And not to mention what they've spilled. And now again, they're running over and it's putting it up into the air.
Mhm.
So this is what we're fighting against. This is our home, our community, and this is what we're fighting against, to protect our homes, our communities, the people that live here.
Yep.
And not just people, but the
Wildlife,
the wildlife. I mean, did you know that at Cottonwood Springs, there are dragonflies that you cannot find anywhere else in the world. It's a micro niche, well, my husband knows what it's called, the micro,
climate.
Yeah, where there's dragonflies you can't find anywhere else in the world. And
Yeah.
they have a pump jack not too far from it.
Yeah.
What's going to happen to those dragonflies?
Mhm. Extinct or yeah.
Yeah.
Horrible.
Yeah. But, you know, there's no studies done to see what's going to happen to them.
No.
None.
Mhm.
Not one.
No.
And you know how I found out about that? Was because I had a dentist that loves dragonflies,
Oh
who
my
makes trips every year from Clovis to go up there to see those darn dragonflies at Cottonwood Springs.
Wow. That's pretty neat. I
Yeah.
love that.
Isn't that crazy? He goes, you lived in Carlsbad? Oh my God, I go every year up there to go see dragonflies that you can only find there.
I did not know that. I had no idea.
I didn't either, but I do now.
Well, dragonflies, yeah, dragonflies are southern New Mexico. I mean, you know, it would be interesting to see how the oil and gas is affecting the dragonflies at Bitter Lake National Wildlife Refuge, because we have, just like you said there, I mean, and it's known, they have a dragonfly festival every year. They have, you know, and that's what I was talking to somebody else the other day, that, you know, I know it's worse for you guys, but it's just over the hill from us in Roswell. And I'm sure it's creeping over the hill.
It is. It is. It is.
You're close
Yeah.
to Puget too, and that refinery is full of emitting benzene, and so yeah, definitely. Absolutely dangerous.
Yeah.
I do see that we're running about 15 minutes over. So are there any other last minute questions? Anything that anyone wants to ask? I had a question for Teresa and Kendra. Do you know if in Chaco in the Northwest, do you guys have daily ozone readings that are published in your paper or anything like that? Can they hear me? Did I lose everyone?
I think somebody had to get off. Lindsay had to get off. I don't know if everybody.
I don't know. Okay, yes. So Teresa said they do have daily reportings in their paper. Okay, I was curious because I know in Eddy County, we don't have that. And I think that would be a valuable tool for sure.
Yeah.
Anyone else? Nope. Okay. And we have all of their contact info, and I will pass it on to anyone that may want it. I'll pass it on to the CCFF community. If you have any questions for any of our wonderful speakers today, thank you guys so much for being here and for sharing your experiences. And also thank you to our interpreters. And I hope everyone has a great night. Thank you for being here.
Thank you, everybody.
Bye.
Bye.
Thank you, everyone. Bye.
Wonderful gathering.